Yes, so NRG-HN015 is a very unique trial in the sense that we have focused a lot on treatment of recurrent head and neck cancer in the realm of recurrent metastatic disease, and we've gotten approval of new agents, specifically immunotherapeutic-based agents, and as you know, chemo-immunotherapy is now an approved treatment, but also immunotherapy depending on biomarker status. This has not really translated very well into the locally recurrent disease that is still resectable. In other words, these patients are able still to have their disease removed through what we call salvage surgery. So we have not really attempted yet in a real way or effective way, even though there are some single institution efforts and some phase 2 single-arm studies that have suggested that, for example, introducing immunotherapy before salvage surgery could be, certainly beneficial to patients. So this trial is the first randomized trial of such a design. It essentially randomizes patients who are candidates for salvage surgery to receive either a chemotherapy before salvage surgery, or chemo-immunotherapy before salvage surgery, or go straight to salvage surgery. So I think the two experimental arms, whether the chemo or the chemo-immunotherapy, will be compared directly to the control arm, which is the current standard of care, that is salvage surgery, and hopefully will help guide us as far as what the future should look like for these patients. Because remember, we don't have randomized data in this setting, so depending on which of these experimental arms is going to lead to more effective control of disease down the line, could be the setting stage for more trials or more definitive trials in the future using novel agents. Remember, we have a plethora now of novel agents being developed in the recurrent metastatic setting, but these agents really have not gotten translated into the salvage surgery setting. So we're very excited about this, and the trial was just activated. I want to just mention that this is a trial that's not really trying to change the surgical outcomes for patients. In other words, if a patient is borderline resectable, we would not encourage this patient to go on this study, because there is the chance that these patients will be randomized to the control arm. And so we've started accruing to this trial, and we look forward that this will enhance our understanding of how to tackle this disease, which is still curable, but its patients are at higher stake right now because they have recurrent disease and therefore at risk for having further worsening of their disease.